Welcome to the YouTube channel of 9.09er English. I'm Coach Ervin and with me is
Coach Brian.
We've been doing IELTS videos for the longest time, but because we listen to you, what's in store for today's video? OET writing, OET speaking videos. Initially, we're going to tell you the main difference between IELTS and OET. We want to begin by establishing that IELTS is exactly the same for all professions. Whereas for OET, this is exclusively for the healthcare professionals. In fact, we want to establish that in OET writing and in OET speaking, the role play cards and the case notes are different for each profession. So it's profession specific. We want everyone to know that even if this is an English examination focusing on medical topics, still, the examiners of OET are going to assess your grammatical range and accuracy, your lexical resource. That's why Sir Brian and I decided that for this particular video, we're going to talk about collocations. So initially, let's ask Sir Brian, what are collocations and how helpful are they in getting the required band score for OET writing and OET speaking?
Well, collocations are combinations of words. So these are nouns and adjective combinations, or verb and adverb combinations, or noun combinations. So these are actually words that you pair together and they blend so well with each other, providing greater accuracy not only for IELTS but also for OET. However, I need to emphasize that in IELTS, there are plenty of collocations that you can use because this is a general examination and the topics can be anything under the sun. But since you're taking OET, and the OET is a medical-related, medical-focused examination, there's just a limited range of collocations that you can use in writing and speaking.
Now, Sir Brian is our master because he is the one who is a registered nurse and registered teacher by profession. I finished a degree in research. That's why I don't teach OET. That's why I'm more of the supporting character or supporting lecturer for today's video. From time to time, Sir Brian discusses the sample collocations that are helpful for OET writing and OET speaking. After he discusses and provides examples, that's when I'll correlate it to IELTS. So even if you are not a healthcare professional planning to take OET and you are considering IELTS, this video might also be applicable for you.
Okay, so let's get started with some collocations for the occupational English test. Let's start with the first one, which is respond. And the collocated word is treatment. For example, when you say respond to treatment. Here's the example sentence. And Sir Ervin, can you possibly read the example?
It says here, although she has responded well to treatment, as evidenced by normal vital signs and inflammatory markers, she still has pain sometimes. So the collocation there, respond to treatment. Sir Brian, let's hear it from the expert in OET.
Well, respond to treatment means that you have been able to recover a little bit, or that the treatment was effective for a particular patient. So this is actually a very useful collocation that you can use both in writing and in speaking. So for example, you have a patient who comes in, your interlocutor is a patient, and you're going to say that the treatment was actually very effective. Then you can say that you responded well to the treatment. In the same case, when you're writing a letter and you're updating a person, maybe this is a discharge letter, and you want to update the person you're writing to that the patient has recovered, or perhaps the effective treatment was given to the patient, you can say that the patient responded well to the treatment. This is very useful for the occupational English test. But I assume, Sir Ervin, that respond will have a different definition most of the time for IELTS.
That's correct. In fact, for IELTS writing, the first criterion is task response, and this pertains to your ability to answer the question. How well did you answer, or how well did you respond to the question? So as you can see, the word respond is part of the English language. However, the function of the word respond differs in the context of IELTS and OET. Now, you might be interested to know that Sir Brian and I actually have a handout here. In some of our recent videos, we informed you that we have these handouts available for the enrollees of our IELTS and OET Platinum Review package. So for those of you who are already enrolled, all you have to do is to visit ninerenglish.com, click Access Your Dashboard. In the event that you are not yet enrolled at 9.09er, we offer a free trial open for all nationalities. All you have to do is to visit ninerenglish.com. Sign up for your free trial. We have an IELTS package and OET package. Depending on the time that Sir Brian and I have, who knows, we might be able to come up with a PTE Platinum dashboard in the future or TOEFL Platinum dashboard in the future. For as long as both of us are still healthy and we have the time in the world to come up with new projects and new videos or new platforms, rest assured that whatever we are doing, this is to make sure that we're going to do better than our best and provide our reviewees and non-reviewees alike with more information. So these are PDF handouts available in our Platinum website, ninerenglish.com, downloadable and printable for those who prefer to have a hard copy. So we're done with the first example. We have here a total of 15, but Sir Brian decided to pick only 5. We're done with respond to treatment. Let's take a look at the second example that Sir Brian has chosen.
For the second one, we have treat, and it's collocated with infection. Infection is a very common condition that is being tackled in the OET both for writing and for speaking. So if you are able to deal with an infection, then you can probably say you're able to treat the infection. So Sir Ervin, can you read the example?
Okay. It says, this will help relieve pain and treat the infection in the long run. It's just that there is the next line which states cure the infection, and there is an X mark, meaning to say it's not appropriate. So, Sir Brian,
Yes.
please tell us more about treat the infection versus cure the infection.
Well, for many conditions, you're really finding a cure. But for an infection, it is usually the case that the properly collocated word, the best word that fits it, is to treat. So you don't say, we cured the infection, we were able to treat the infection.
That is correct. Now, in the case of IELTS, well, the word infection might be used from time to time, but not as common as the OET. Remember, for OET, we're dealing with cases that can possibly be encountered in the hospital or the clinic or used by community health nurses or private duty nurses. Whereas for the IELTS, as Sir Brian explained earlier, it's literally anything under the sun. So in IELTS, if you want to use the word treat, maybe you passed the board examination and you are celebrating. That's why you'd like to treat your friends and your relatives. But in OET, there is a specific use of the word treat. So 2 down, 3 more sample collocations to go.
So the third one is provide relief. This is an excellent collocation, very useful for your OET, and most specifically for pain. If it's providing relief, then it means to say that we're able to reduce the intensity or the severity of the condition or the pain that the patient is feeling.
I'll just read the examples that we have here. Analgesics were administered to provide relief from pain. And then the next line, it says, kindly conduct daily home visits for the first 2 weeks to teach and help him cope. So we have conduct a home visit versus undergo a home visit. What do we have here?
So when it comes to home visits, you actually conduct them and you don't undergo them. Maybe you undergo surgery, but you do not undergo a home visit. It's not something that you have to go through. So we usually say conduct home visits. Establish a diagnosis. So establish the diagnosis. So this is usually used when you are writing and you are reporting that a particular diagnosis or diagnoses has or have been made. Okay, so you say that the diagnosis has been established.
Guys, you might be wondering why we are wearing color blue. That's because we always have a theme for our videos. For IELTS, the official color is red. For OET, the official color is blue. That's why we make it a point that we are following the theme for today's presentation. Now, just in case you are curious to find out the other contents of this handout, we won't go into detail. We don't have all the time in the world to enumerate them and discuss them one by one. But here we have suppress the cough. Another one is develop a bed sore. We also have seek medical attention, check or take temperature, regain consciousness. What else do we have here? We also have make some improvement or show some improvement, make a complete recovery or recovering well, and then pose a risk or pose the risk. Our dashboard contains several handouts. The last time we checked, at least 4 dozens of handouts. So our handouts focus not just on grammar and vocabulary, but also phrasal verbs, collocations, medical abbreviations that are sure to help the future OET passers like you guys. We've been doing English examination preparation since 2007, and we're planning to make this global. Right now, we have reviewees from 119 countries worldwide, but 66% are Filipinos. So we are hoping that we can possibly reach more OET examinees worldwide with the help of our free videos on YouTube. So before we end our discussion for OET collocations, Sir Brian, anything else you'd like to add regarding vocabulary for OET to help our subscribers worldwide?
Yes. Familiarization is very important if you are to get a good score in the vocabulary aspect of OET. And I understand that there are not a lot of materials online that you can actually find that will give you information on what particular words to use, which combinations are great for your examination. And here at 9.09er, we are offering you lessons that will help you to enhance not just your skill in taking the examination and your aptitude to pass the test, but also enhance your vocabulary in the medical environment for you to be able to succeed or ace your OET.
Thank you very much for your time, and for our next video, we'll cover another topic that will help you pass OET. Once again, we are Coach Ervin and Coach Brian of 9.09er. Thanking you for your time, and we'll see you in our next video. Bye!
Bye!